Levetiracetam tablets can be given to you if you have epilepsy disorder. It is one of the anti-epileptic agents that acts by unique mechanism. Epilepsy results when a few excitatory neurons are out of control and excessively firing. Levetiracetam controls these neuronal activities, and it slows down their rate of firing. It is well popular under many brands, including Keppra. In this video, let's explore key facts about this medication. How it works. How to take this medication. What is Keppra? How it affects attention. What to avoid. Let's discuss all such information. Where is it used? You may be given this medication to treat different types of epilepsy. Normally, it can be given as an adjunctive along with other anti-seizure medication. One of its clinical purposes is to treat myoclonic seizures. These are a brief and sudden onset jerking of muscles that are uncontrollable. They are commonly observed in children, especially after waking up. However, they are also seen in adults. Levetiracetam can be used to treat these seizures in adults and children age over 12 years. Another indication is in the treatment of partial onset seizures. These are a group of epilepsy disorders that affect a specific area of your brain. Levetiracetam can be used in this condition both in adults as well as in children, including infants aged greater than 1 month. Levetiracetam can also be used to treat generalized tonic-clonic seizures. This is one type of epilepsy that involves repeated jerky muscle movements along with loss of consciousness. They last for around 2 minutes, followed by a state of confusion and sleepiness. Levetiracetam can be given to adults and children aged 6 years or older. How is it given? You can get levetiracetam tablets in 2 variants. One is an immediate release tablet, and another one is an extended release tablet. Both are not equivalent due to their differences in the rate of release of medication. It is also available as a tablet for oral suspension. Such tablets are rapidly dissolved when placed on the tongue, followed by a sip of water. They should be swallowed after disintegration of the tablet in the mouth. However, they shouldn't be swallowed intact. The dose of levetiracetam is variable based on your age, body weight, renal function, and purpose of use. Dosing frequency is also variable based on which type of tablet you are using. For example, if you are using an immediate release tablet, it may be given to you 2 times a day. However, an extended release tablet is given once daily, as it delivers the medication slowly throughout the day. Generally, levetiracetam may be started at a dose of 1,000 milligrams per day. It may be given as 500 milligrams immediate release tablets for every 12 hours in the day, or as 1,000 milligrams extended release tablets given once a day. Therefore, these tablets are not equivalent, and you can easily identify them by checking the strength of levetiracetam in each tablet. Levetiracetam can also be started at a low dose based on a few conditions, like your age and renal function. Dose increments can be done over 2 weeks, and the maximum dose is 3,000 milligrams per day. For children under 16 years old, levetiracetam is given based on body weight. Your doctor will suggest the right dose based on the age group of children. How it works. Epilepsy results in excessive activation of a few neurons in your brain. Due to overstimulation and loss of control of these neurons, they affect a specific group of organs they supply. For example, overexcitation of neurons supplying to muscle may result in jerky movements with increased muscle tone. Levetiracetam blocks this excessive neuronal excitation and slows their conduction. In your brain, a chemical mediator called glutamate is mainly responsible for fast conduction of impulses in neurons. It is one of the excitatory amino acids that is highly essential for many activities in your brain. However, in a few people, neurons supplying glutamate are excessively fired. This may lead to a variety of epilepsy disorders. Excitatory neurons in the brain are well connected, and they form junctions called synapses. This is the presynaptic neuron that stores glutamate in the vesicles. When a stimulus reaches this neuron, glutamate is released, and it acts on postsynaptic neurons. To deliver chemical communication, postsynaptic neurons are equipped with receptors for glutamate. AMPA is such a type of receptor that is responsible for fast conduction of sodium ions into the neurons. This results in stimulation of postsynaptic neurons. When these neurons are excessively fired, it may result in epilepsy. Antiepileptics work by different mechanisms to suppress this neuronal activation. However, levetiracetam shows a unique action. It blocks a protein on the storage vesicles in the presynaptic neuron. It is called SV2A, synaptic vesicular protein 2A. This protein is required for activation of vesicles to release glutamate. When this protein is inhibited, glutamate is not released. This prevents excessive neuronal activation. By this way, levetiracetam reduces the symptoms of epilepsy. What is the effect on mood? Use of levetiracetam can cause a few mood and behavioral changes. It can make you angry and aggressive. You may have nervousness, irritability, and increased anxiety. Occasionally, it can also induce depressive symptoms and a low mood. However, these side effects are not observed in all people. So if you find any abnormal mood changes and rage during therapy, you should talk with your doctor. Levetiracetam can also cause hallucinations and abnormal thinking, especially in children. Even though their effectiveness is not fully clear, for a few people, pyridoxine supplements may be given to control mood changes. Your doctor will better suggest their use, based on your conditions. Effect on attention and focus. Use of levetiracetam can reduce your attention, especially in the first month of the treatment. It can make you sleepy and drowsy. You may have confusion and less focus. It can also cause incoordination in your movements, leading to a loss of balance. Therefore, you should be cautious while involved in the activities that need more attention. Especially, this is more important in the first few months of therapy, and your body slowly adjusts to this medication. Until then, you should be careful while driving a car or any vehicle. Effect on alcohol. Drinking large amounts of alcohol can increase sleepiness produced by levetiracetam. So limit your alcohol intake to avoid such effects. It is also better to avoid alcohol on the early days of treatment. Sudden withdrawal. Never stop use of levetiracetam suddenly, as it may increase the risk of seizures. Levetiracetam works on a few groups of neurons that bring excitation to your brain. If you suddenly stop taking this medication, the control on these neurons is removed, resulting in their excessive firing. This results in the sudden reappearance of seizures, leading to jerky muscle movements and muscle spasm. Therefore, don't stop this medication suddenly without consulting your doctor. If you forget a dose, you can take it whenever you remember within 8 hours. But never combine two consequent doses. Skin rash. If you develop any skin rash during use of levetiracetam, consult your doctor immediately. It may be a hypersensitive reaction that may be observed in a few people. It can also impact other organs like the liver and kidney. You may have a swelling in your throat. However, it is a rare side effect not common in all people. Your doctor will assess whether the rash is associated with hypersensitivity or not. What are the side effects? This medication can cause sedation and sleepiness. It can make you feel dizzy and tired. You may have confusion and a temporary loss of memory. Headache, nasal congestion, and decreased appetite are also observed. In a few people, levetiracetam can cause irritability, nervousness, and aggression. You may also have vertigo and loss of balance. That's all, guys. This is information regarding levetiracetam and how to take it. Share your experience in the comment section below. Thanks for watching this video. Have a great day.